Wait, you guys, we did it! It's our last sketchy farm unit. You know, it seems like only yesterday we were taking a stroll through that autonomic section. You remember that sketch with the antiemetic stadium? A preppy ant. I mean, that's just a good mnemonic. Oh, and do you remember the creepy Edgar Allan Poe one? I have no idea what was going on there, but for some reason, I was eerily aroused. Anyway, I hate to say it, but we're about to wrap up Sketchy Farm, and our grand finale? Cancer chemotherapeutic agents. Cancer can be treated regionally through surgical removal or targeted radiotherapy. Chemotherapy, on the other hand, involves the systemic administration of cytotoxic drugs to eradicate or control the proliferation of cancer cells. However, their dispersal throughout the bloodstream means that these drugs reach both cancerous and normal cells alike, leading to significant systemic adverse effects. Compared to slowly dividing cells, however, rapidly proliferating cells like cancer cells synthesize larger amounts of DNA and RNA per unit time. The pathways involved in de novo nucleotide synthesis therefore have become attractive targets for the control of rapidly dividing cells. And when I say attractive targets, I mean ridiculously attractive, like Idris Elba attractive. This entire chapter focuses on antimetabolites, molecules that exert their antiproliferative effect by mimicking the intermediates involved in various steps of nucleic acid metabolism. They can masquerade as a purine or pyrimidine, for example, the nitrogenous bases that form the backbone of DNA. This tricks a tumor cell into incorporating these molecules into DNA, leading to strand breaks. Or these drugs work by replacing other key intermediate molecules necessary for the production of new bases, like a folate analog, for example. This clogs up the enzymatic machinery responsible for DNA synthesis, and cell growth is halted. In this sketch, we're going to focus on anti-metabolite drugs that inhibit the enzymatic pathways involved in the formation of thymidine specifically, with special attention paid to agents that affect the folic acid cycle, but we'll get into that in a bit. Thymidine is a pyrimidine deoxynucleotide. Deoxynucleoside just means that it has one of those deoxyribose pentose sugars attached. I know, who cares, right? It's the pyrimidine nitrogenous base we're going to emphasize here. At Sketchy, we depict pyrimidine and purine bases by their molecular structure. Just think back to the acyclovir airport or the gancyclovir market. Purines such as adenine and guanine are represented by a hexagonal shape attached to a pentagon. Gancyclovir is a guanosine analog, remember, as depicted by these gancyclovir cans. Pyrimidines, on the other hand, such as thymine, cytosine, and uracil, are depicted by their lone hexagonal structure, like this hexagon plate here on the sushi bar counter. The synthesis of thymidine is catalyzed by thymidylate synthetase. You know, because it synthesizes thymidine? I mean, that's just a good name. You know what I call gloves? Hand socks. Anyway, this enzyme works by methylating a phosphorylated uridine called deoxyuridine monophosphate, or DUMP, and turning it into a phosphorylated thymidine called deoxythymidine monophosphate, or DTMP. Think of it this way. See that hexagonal plate of dumplings? It's hexagonal because it depicts a pyrimidine precursor molecule, and the dumplings are meant to represent DUMP specifically. Once a customer chows down on those DUMP dumplings, it's converted into DTMP, as you can see here. You've got one dumpling left for the D, and then a pair of chopsticks are set down on the plate, evoking the thymidine T. This whole reaction, turning DUMP to DTMP, is powered by the folate cycle, represented here by the cycle of sushi boats going by. Uridine is methylated to turn into thymidine, so it just needs a carbon, right? Take a look at that incoming boat on the left. It turns out that a methylated tetrahydrofolate provides that carbon. At Sketchy, we represent folate with foliage. So in this scene, tetrahydrofolate is represented by a boat with 4 leaves, probably some Mizuna or something. And that C-shaped sushi represents the carbon available for donation. As the boat floats by, the customer dining on those DUMP dumplings transfers over that carbon sushi to his plate, inadvertently knocking off 2 of the folate leaves as well. Thus, tetrahydrofolate is converted to dihydrofolate and DUMP is methylated to DTMP. This whole process catalyzed by thymidylate synthase. In order to keep producing more thymidine deoxynucleotides, you need to recycle that folate so it can donate more carbons. In other words, you've got to turn that dihydrofolate back into tetrahydrofolate, and here's how that happens. Stay with me here. Dihydrofolate, represented by the boat with 2 leaves, gets converted back to tetrahydrofolate by the enzyme dihydrofolate reductase. It's a reductase because you're adding 2 hydrogens, so you're reducing it. Notice that tetrahydrofolate is again represented by the boat with 4 folate leaves. Well, tetrahydrofolate is a carbon donor, so let's get that carbon back on it. A methyl group contains a single carbon, so tetrahydrofolate is then methylated, represented by the addition of the C-shaped carbon sushi. Tetrahydrofolate is now ready to donate some more carbons and methylate those deoxyuridine dumplings into some brand new pyrimidine nucleosides. That is, unless you throw our first antimetabolite agent into the mix, methotrexate. Methotrexate is a folate analog, so it looks like folate, but it's not. It competitively and irreversibly binds to dihydrofolate reductase, preventing the conversion of dihydrofolate into tetrahydrofolate. Think of methotrexate as this methotrexate meat stick chef. He's trying to replace folate like a folate analog, if you will. Instead, he's irreversibly upended that sushi boat and brings the folate cycle to a halt. With dihydrofolate reductase irreversibly inhibited, targeted cells can no longer regenerate tetrahydrofolate, and as you can imagine, the precursors folate and dihydrofolate will build up inside the cell like this traffic jam of dihydrofolate sushi boats. No tetrahydrofolate means no de novo synthesis of that thymidine nucleoside DTMP we keep talking about. And that's not all, because tetrahydrofolate is also involved in the synthesis of purine nucleosides and some amino acids as well. Inhibition of these metabolic pathways interferes with the formation of DNA, RNA, and key cellular proteins inside rapidly dividing cells. Dividing is the key here. Rapidly proliferating cells such as cancer cells and inflammatory cells are preferentially inhibited by methotrexate because it's these cells that are producing substantially greater quantities of nucleotides. So, since we're targeting DNA synthesis specifically, antimetabolites like methotrexate and the rest of the agents in this chapter are most effective during the S phase of the cell cycle, the stage when cells are undergoing synthesis of new DNA in preparation for cell division. In fact, many of the anti-cancer drugs in this unit exert their action on cells traversing a specific phase of the cell cycle and are therefore called cell cycle specific. Whenever an anti-proliferative agent is cell cycle specific, we'll be sure to depict that particular stage within the sketch, like in the name of this sushi restaurant here, sushi phase. Also, because these agents prevent the synthesis of DNA, their logo depicts a pair of chopsticks clamping down on that growing strand of DNA-evoking ramen noodles. This is how methotrexate acts as a chemotherapeutic agent. It's a folate analog that halts DNA synthesis in rapidly dividing cells, leading to cell death. It's cytotoxic. I mean, just take a look at this broken cancer crab here, our recurring sketchy symbol for agents with anti-neoplastic effect. Methotrexate can be used in combination with other chemotherapeutic agents to treat a range of malignant conditions, especially leukemias, lymphomas, as well as solid tumors such as breast cancer, head and neck cancer, and lung cancer. Also, because methotrexate causes death of all rapidly dividing cells, it can be used to treat a wide variety of non-neoplastic conditions that are characterized by abnormal cellular proliferation. Just take a look behind our methotrexate chef, where a couple of customers are emptying their backpacks and making off with a few more of those methotrexate meat sticks. I mean, it did say all you can eat. Though, I don't know how well those are gonna save. They should probably wrap those in like a napkin or something. Anyway, take a close look at that overturned backpack and you'll notice that it looks somewhat uterus-like. Methotrexate can be used for the termination of intrauterine pregnancy in conjunction with misoprostol. It inhibits trophoblast cellular division, thus decreasing trophoblast survival, hindering implantation, and encouraging expulsion. Methotrexate is also the drug of choice for the non-surgical treatment of an early, unruptured ectopic pregnancy. That's because folate antagonists are effective in hindering the growth of rapidly proliferating cells in developing embryos. See that little baby keychain clinging onto the outside of that uterus? It's just like an ectopically implanted embryo. Aberrant fertilization events can also lead to gestational trophoblastic neoplasias, including trophoblastic tumors, choriocarcinoma, and invasive molar pregnancy. Each arises because of an abnormal proliferation of trophoblastic tissue, and most low-risk patients can be cured with a short course of methotrexate chemotherapy. So as she makes room for those purloined methotrexate meat sticks, a little mole stuffed animal falls out of her backpack as well. Kind of like the termination of an invasive molar pregnancy, if you will, and you probably should. Just trust me on this one. You know, these sketchy medical videos reach a wider audience than you'd think, including droves of young preteen fans. I mean, we're like the teen idols to them. That's why they call me Jordan Knight. Oh, is that too outdated? Kirk Cameron? Anyway, we try to set a good example, and that's why we've added this totally rad protective equipment to these skater punks. Wait a minute. Silvery scale on extensor surfaces? That can only mean one thing: psoriasis. Psoriasis is a common chronic skin disorder most commonly characterized by erythematous plaques with silver scale and hyperproliferation of the epidermis. So, proliferating cells, we can use methotrexate, right? Yes, and it's also effective for the treatment of psoriatic arthritis and psoriatic nail disease. Initially, the mechanism of action was thought to involve the antiproliferative effects of methotrexate on rapidly dividing epidermal cells, though more recent evidence supports the concept that it's actually the immunosuppressive effect of methotrexate that controls psoriasis. That's right, neoplastic cells aren't the only rapidly dividing cells targeted by this antifolate agent. Methotrexate also effectively inhibits the proliferation of immune cells and is therefore used to treat a wide range of chronic inflammatory conditions. You see that lantern we've sketched in above our methotrexate meat chef? The design should remind you of a joint. Not only that, the flame sitting inside should remind you of the inflammation associated with rheumatoid arthritis, or RA specifically. This symbol is actually going to show up throughout this unit whenever we want to highlight the immunomodulatory agents used in the long-term management of RA. The foundation of long-term therapy consists of disease-modifying anti-rheumatic drugs, or DMARDs, DMARDs, including methotrexate, sulfasalazine, hydroxychloroquine, and TNF-alpha inhibitors. These agents inhibit the proliferation of immune cells responsible for the chronic inflammation and long-term joint destruction that eventually leads to disability. On your exam, a typical clinical scenario will involve a middle-aged woman with swelling, pain, and morning stiffness in multiple joints for more than 6 months, as well as some other characteristic systemic symptoms. Methotrexate is the preferred first-line disease-modifying treatment for most patients with moderate to severe RA, though response to DMARD therapy typically takes weeks. Short-term treatment with anti-inflammatories like glucocorticoids or NSAIDs can provide temporary relief of symptoms, but they do not provide adequate long-term control of disease or prevention of joint deformity. For that, methotrexate is often your go-to agent. It doesn't stop there though, because methotrexate's immunomodulatory effects are useful in the management of numerous other chronic inflammatory and autoimmune disorders such as IBD, lupus, vasculitis, and dermatomyositis. So we've included a few antibody-evoking lanterns as well, torn in order to highlight methotrexate's ability to suppress the immune system. Alright, let's talk side effects. When methotrexate reaches the systemic circulation, it causes death of all rapidly dividing cells, leading to a characteristic set of adverse effects that you are more than likely to run into on your exam. First off, remember that methotrexate is a folate analog that directly binds to dihydrofolate reductase, inhibiting the body's ability to regenerate the active form of folate, tetrahydrofolate. This can lead to a state of folate deficiency, as evidenced by that foliage that tumbles to the restaurant floor. And this can cause megaloblastic anemia, which is a form of macrocytic anemia in which nucleic acid metabolism is impaired, leading to reduced